The World Health Organization has urged neighboring countries not to close their borders or restrict trade with the Democratic Republic of the Congo. This after the global body declared the Ebola outbreak there a health emergency of global concern. The WHO says the possibility of the outbreak spreading remains high. Joining us on Skype now on Skype to discuss this issue further is the agency's emergency regional advisor in West Africa, Dr. Ngoy Nsenga. Dr. Ngoy, thank you so much for speaking to us. Just take us through the numbers of this latest outbreak in the DRC from 2018 to now.
Okay, thank you very much, and thank you for having me. First, just a small correction. I'm now the team lead for Eastern Southern Africa. I'm based in Nairobi. So, yeah, I mean, as you said, the outbreak of Ebola in DRC has been there for close to 9 months now. And recently, because of the recent evaluation of the situation in Eastern DRC, the emergency committee advised the general director of WHO to declare the Ebola in Eastern DRC as public health emergency of international concern. So up to now, we have crossed the threshold of more than 2,000 deaths and 2,000 cases of Ebola and more than 1,000 deaths. So the situation, however, let me say that we have also to congratulate colleagues who are on the field who have been battling this outbreak, not only WHO colleagues, but also the Ministry of Health and other agencies, that until now, the outbreak is well contained in Eastern DRC. Of course, we had 3 cases that crossed the border to Uganda, but until now, we haven't had any case of Ebola in neighboring countries.
One of the things that is now coming out is the fact that with this declaration from the WHO, will this limit trade with the DRC? What does this mean for the DRC itself?
Yeah, there is a certain fear. The declaration of public health emergency, first of all, the international regulation is very clear about that. No restriction to trade, no restriction to population movement should be imposed against the affected area or against the affected country. That is very clear. And the emergency committee, they also made it very clear. But given what happened in West Africa in 2014 and 2013, there is a fear that some neighboring country might resort to closing the borders, or not only neighboring countries, or some airline may resort to suspend their flight to affected area or even to DRC. That's the fear. But in reality, the emergency committee recommended all countries, not only neighboring countries, but all countries, not to impose any restriction to either trade or population movement with DRC.
Okay, Doctor, can you speak about the experimental Ebola vaccine? It's got quite a long name, and it's called Zebov, if I'm right here. But that experimental vaccine has also proved to be highly protective against the deadly virus, I think 97.something%. Is that vaccine actually being used now in this fight against the spread of the disease in the DRC?
Absolutely. The vaccine was first used toward the end of the outbreak in West Africa, in Guinea specifically. And in Guinea, the vaccine was shown to be 100% effective. And now the vaccine, since the beginning of the outbreak, from the beginning of the outbreak, the vaccine has been used in Eastern DRC. But I have to say the vaccine, because it's at experimental level, is given to certain specific category of people. These include those who have been in contact with patient and those who have been in contact with the contact of the patient. And of course, the frontline health workers. When we say frontline health workers, it means those who are working in the health side, but directly exposed to being in contact with the patient or contact of contact. So these are the category that are right now being vaccinated. vaccinated. In addition to vaccinating people in Eastern DRC, the area that are directly affected, this vaccine is also used already in neighboring countries, what we call priority 1 neighboring countries, most at-risk neighboring countries, that is South Sudan, Uganda, Rwanda, and Burundi, to vaccinate the frontline health workers preventively before getting the outbreak crossing these borders.
All right, Doctor, the other thing as well is that having Ebola is not a death sentence as well, isn't it? A simple treatment interventions, especially early on, can actually save lives.
Absolutely, and this has been shown not only in West Africa and again in Eastern DRC, that there is a chance of survival increase as you seek healthcare sooner enough of detecting, of having symptoms and signs that look like Ebola. That's what we are encouraging people in the affected area not to run away from the health facility, but as soon as you feel like you are being in contact and you feel some sign and symptom, to go to the health workers, to go to the health facilities, because the earlier you start the treatment, the better the chance of you getting out. That's why, at first, I mean, in earlier years, there was no, we used to say, the health workers used to say, Ebola is no treatment. But not only treatment in terms of pills or medicine that are directly acting on the virus, but also taking care of the whole illness of Ebola is much better to be taken care when the symptoms start at the beginning of the disease, and the chance of healing, the chance of survival is much higher.
All right, so there is early on intervention that can take place. Thank you so much, Doctor, there for speaking to us. Dr. Ngoy Nsenga, speaking about the situation with the Ebola outbreak in the Democratic Republic of the Congo. Over 2,500 cases reported so far and over 1,705 confirmed deaths from that outbreak, the 10th outbreak in that country.